Good morning, Mr. Weeks. Thanks for joining us here at the API to speak about some developments, a project in particular, the ECHO project, that has been launched recently. Good morning and welcome.
Thank you. Thank you for having me.
Well, the ECHO program has been officially launched, but enlighten us to what the program is all about.
If I can give a brief background, about 3-4 years ago, the Caribbean Child Support Initiative that is based in Barbados, who were the main supporters of the Roving Caregivers Program in St. Vincent. The Roving Caregivers Program is a program where caregivers are trained to go to households where there are children 0 to 3 years old and to help the parents to stimulate them and to encourage early conversation, early development in these children. CCI thought it necessary that RCP should be institutionalized, and a consultant was hired to review a few countries. St. Vincent was one of those countries that were reviewed, and they found that our health system, as it stood at that point in time, was really structured in a way that could be positively impacted on by infusing RCP principles into our existing system of community health care.
Can you just explain to me what some of these principles are?
Okay, it is established that children who are exposed to various forms of stimulation early in their life do better, well, eventually academically and otherwise. So if you stimulate them early, they are engaged in conversations much earlier. And so when they go to school, they learn better and the outcome in life is much better. And so the RCP, the Roving Caregivers Program, used those principles as the basis for going into households where there were children 0 to 3 year old who otherwise would not have had the exposure, and who assisted the parents in stimulating the children, providing a kind of environment in an informal setting in the home, somewhere in the living room, under a tree, and provided that kind of environment for the children to get this early exposure.
So, and just who is this targeted to? What sort of households?
It is targeted to households who we consider to be less privileged, who would not otherwise be exposed to this kind of development. But of course, we encourage all households, all where their children, to use these same principles in developing their children. But the RCP target, because you could not cover, based on the resources available, we could not cover the entire country. So they selected some areas where, based on established information, there were some higher levels of poverty than the rest of the population, and selected some of these and targeted them.
Before we get too sucked up into the RCP, let's talk a little bit more about the ECHO program and how this really and truly is it like a follow-on from the RCP?
Okay, so I was mentioning that the study was conducted and found that our system was really good and a really good place that they can establish. And so St. Vincent was selected as a pilot area. So what we're doing in St. Vincent is a pilot. A lot of monitoring and evaluation is going on. A lot of it is recorded with the hope of implementing it in other countries in the Eastern Caribbean and elsewhere in the world. So as you see, you're correct. The ECHO project is really a follow-up of the RCP, where we're using the RCP principles. And maybe I should explain how our system of community health is executed, and that may enlighten us a bit better. In St. Vincent, our emphasis is on primary health care. So apart from the main hospital in Kingston, where we provide secondary and some tertiary care, our focus is on our 39 health centers that are spread throughout St. Vincent and the Grenadines. There, the basic health interventions are provided, maternal and child health, family planning services, a doctor's visit. In each clinic, you would have a staff nurse, nursing assistant, and a community health aide. One of the main role of the community health aide is to visit households, visit families, and to intervene in the entire family setting, and to make referrals where necessary, and to encourage households, persons in the households, to access healthcare where they see fit. So it was felt that because we had that really good setup, that in order to sustain roving caregiver principles, that if we were to train our community health aides, it would give them additional skills and would make their job, allow them to execute their jobs better, so that when they go to the households, they can spend some time with the 0 to 3-year-old children and help in their stimulation that would eventually assist in the education outcome of the children, and most definitely in their health outcomes in the long run.
So in the case of the Roving Caregivers Program, this was under what ministry?
This was under the Ministry of National Mobilization. Actually, it is still under the Ministry of National Mobilization, but it is supported primarily by a grant and through support from the Caribbean Child Support Initiative. The persons the caregivers, the rovers as they are commonly known, they are not civil servants, they're not on the establishment. It is felt that sometime in the future, the support will dry up. That is provided now. That is carrying the Roving Caregivers Program now. That support may dry up eventually. And so we needed to institutionalize the system. And that's why the Ministry of Health, because we had this extensive community outreach, that is why we were selected for the ECHO project.
So what's the vision of the ECHO project?
The vision is, if I may go back to what we're doing in healthcare and what we're doing as a nation generally. If you look back over the last 5, 6, 10 years, so to speak, you can see that there was tremendous emphasis on education. There were a lot of schools built, and particularly in the last few years, there were emphasis on the early childhood education. Now emphasis is somewhat shifting to health. We know that the 10th EDF, we've heard the announcement that the 10th EDF would be dedicated to health sector reform, and some of the things that were done in education are going to be done in health. One of our main problems in healthcare is our high incidence of chronic non-communicable diseases. Now that can only be managed through a system of lifestyle change, because the incidence of that is highly correlated with lifestyles, the way you live, the way you eat, the activities you're not involved in. CNCDs, the incidence of non-communicable diseases are highly correlated with lifestyle. So what we're doing in ECHO fits really into what's happening nationally at the national level and in the health sector. By this I mean, now that emphasis is on early childhood education generally, but particularly early childhood education, that in the formal education system, that is taken care at the 3 to 5 age group. What we are doing now, we're taking care of the 0 to 3 age group, and
that's the time when
that's the time when a lot of the development takes place and would depend and would determine the eventual outcome of one's life, so to speak. So what we're doing really fits really nicely into what's happening nationally and what's happening in the Ministry of Health and the health sector generally.
So what you are looking really to do is essentially create a change in culture, perhaps?
Yes, we are hoping that at that very early stage of development, that we will have that kind of interaction with the healthcare provider. We would break the cycle, yes, and we will get these children to use the health system. They use it generally now, but we'll get them more to use the health system generally throughout those first years of life. We would give them, the parents, that is additional skill how to look after the children. As I said at the beginning of the interview, it is established that early stimulation assists with development greatly, development of the personality, development of the child greatly. Now, if we infuse that at this early stage of the child's development, we're hoping that that will follow the child through, and 15, 20 years down the road, we will see a positive change in what's happening in terms of the national epidemic, the national health profile of St. Vincent and the Grenadines.
Okay, so for those of us who might be a little bit confused, make the distinction for me between the Roving Caregivers Program and the ECHO program.
There is not much of a difference in terms of what both programs are trying to do. The Roving Caregivers is established. It is housed in the Ministry of National Mobilization. It has been here for some time. We would have seen these persons on television from time to time in their publicity, in their sensitization efforts, on the trees, singing with the mothers and their children, and demonstrating what they're doing. So this program is established. What we are doing now in the ECHO program is a pilot where we are using those same principles that are used in the RCP to create the same kind of interventions at the health level, where instead of the non-established workers, that the established workers, the established public officers, who we know would be there for a long time, they will use some of these same skills in their everyday work as they go visiting the households, which is part of their regular work. They will use some of these same principles and try to get the outcomes in the household that the RCP was producing all along.
Can you give me a bit of an idea of how the program is going to be executed? Is it going to be executed in a similar fashion as the RCP program?
Well, as I said, the Caribbean Child Support Initiative, UNICEF and PAHO, they are providing us with financial and technical support for the implementation of the ECHO project. It is housed in the Ministry of Health and the Environment, and more particularly in the Community Nursing Service. That's where the project is housed. We have a coordinator who we have hired to implement the project, the pilot project. She works closely with the Community Health Service. We have a steering committee, an administrative committee that meets on a regular basis, make decisions about the program. We have an established work plan, and one of the first feature of that work plan is for us to train the community health aides who are going to be carrying out the field work, so to speak. A couple of weeks ago, we had the launching, which was very successful. And immediately after the launching, we proceeded with the training. We have had a full 3 week of classroom sit-down demonstration exercise. We had 2 days of field testing this week, Monday and Tuesday. This week we had the field testing where the community health aid, the 20 community health aides who are being trained, they actually went out in the field with support from the rovers, the persons who work in the Roving Caregivers program, and with other community health aid from outside of the district, because the project is really based initially in the Calico Health District. So we had the field testing Monday and Tuesday this week. And there will be a further 8 days or so of actual demonstration in the field where the community health aide would be continued to be supervising in the field. That will be taking place up to, I think, the 12th of this month. After that, there will be a graduation, and they will go back to their clinics where they are based. The families will be selected, and they will begin to work with the families where we have 0 to 3 children.
That's out from the clinics?
Yes, they will be working from the clinics.
Okay, we're running out of time here, but this is your opportunity to make final comments. I don't know if you want to maybe make an appeal.
What I would like is for the parents, the households where we have these 0 to 3 children, especially at this moment in the Calico Health District, and for the public Calico Health District runs from Sign Hill all the way out to Stubbs. So all the clinics in between that are involved in the pilot project. I'm encouraging parents whom we approach to be involved in the project to give us their assistance to ensure that they benefit, particularly their children. They as parents would benefit because there will be parenting skills that would be imparted to them as well. But the children more so will benefit coming out of this project. And the country as a whole will benefit in the long run, because we are hoping that 15, 20 years down the road, we will be producing healthier citizens based on the intervention of this project.
Mr. Weeks, thank you very much for visiting us here at our studio and updating us on these new developments and initiatives. Do keep us up to date, and all the best.
Thanks for having me. Thanks.